I found out I had prostate cancer, and I had gone to MD Anderson down here to do the biopsies, and they found out it was probably spread more than I knew. And during that process, whenever they had scheduled me to go in for some treatments, well, Dr. Schlembach had asked me if I had had a colonoscopy, which I replied no. And at my age, she said I needed to do that before I could proceed with the radiation treatments, because that was probably more pertinent to my health than the prostate cancer. So she proceeded to set me up with the center down here in downtown, and through many times that coming in, which the first time they found I had some issues that had many polyps that needed to be removed, and they also found a mass that needed to be removed, and so they had to get a specialist in to remove that, because they tried with some other folks and that didn't work. So they had Dr. Raju come in, which I was very happy with. Dr. Raju was an excellent guy. I mean, he called me all the time at home. He'd make sure I was doing fine, and so the procedure was uncomfortable, but necessary and very well performed. So I had made several, like I said, several trips. The first few times they got some polyps out, and they were all benign, thank God. And but then that mass, they had a little problem with that, and they were more concerned with it. But so they had to make a special time for that to be removed, and had to put some staples in, and I think he put 7 or 8 staples in to hold my colon back together because it had torn it in the removal process.
This is a very large polyp in the colon that was removed after injection of fluid underneath the polyp to separate it from the wall, and then cutting it with a snare device, and then subsequently cleaning the edges and closing it with clips to prevent bleeding or perforation. And the specimen was sent for pathology, no cancer, and 3 months later, nicely healed scar.
Which he explained it all that wasn't that big of a thing, because they didn't have to remove the colon, or any of the colon, but just staple it together.
A lot of people are afraid of undergoing colonoscopy. And people, if they hear a story that somebody had a perforation and they required surgery to close that, that will put a lot of people away from going through an important procedure that could save people's lives from colon cancer. We should understand that the colon wall is very, very, very thin. It's about 2 millimeters in thickness, probably that much. And when you shave off half of that, you are left with maybe 1 millimeter or 1.5 millimeters. So if your cut is a little bit deep, you end up with a perforation. And if you cannot fix that perforation, that patient would end up requiring surgery.